Everyone passes gas. In fact, the average person passes gas 10 to 20 times per day. But if you're constantly gassy, uncomfortable, or worried something is wrong, there may actually be a reason behind it. Today, I'll explain the most common causes of excessive gas, what foods are usually responsible, and when gas could actually be a sign of a medical problem. One possible cause is swallowing too much air. Some explanations could be eating too quickly, drinking through straws, chewing gum, drinking carbonated beverages, or talking while eating. It's important to slow down when eating and drinking. A second cause is high FODMAP foods, which I've described in previous videos. These are certain carbohydrates which ferment in the intestines. Some examples of high FODMAP foods include onions, garlic, beans, lentils, apples, and wheat products. These foods are all healthy, but can cause a lot of gas in sensitive individuals. A third cause is dairy intolerance or lactase deficiency, also known as lactose intolerance. This is when a person has a low level of the enzyme necessary to break down dairy products. Therefore, if they have a lower level of this enzyme, they could present with gas after milk, bloating, cramping, and loose stools. One tip is try reducing dairy for 1 to 2 weeks to see if your symptoms improve. A fourth cause of gassiness is something that I always remind my patients is artificial sweeteners, which they often forget about. Some examples include sorbitol and mannitol. These artificial sweeteners can be found in sugar-free gum and candy, as well as in some diet products. These artificial sweeteners are poorly absorbed and commonly cause gas. A fifth cause that many patients don't realize is having underlying constipation, which can be common. Constipation could be caused by a low-fiber diet, inadequate hydration, or general physical inactivity. A sixth cause of excessive gassiness could be due to irritable bowel syndrome. Irritable bowel syndrome often causes gas, bloating, abdominal discomfort, and altered bowel habits. IBS patients could be more sensitive to normal amounts of intestinal gas. When would I be concerned about excessive gassiness? It would be associated with other types of signs and symptoms. These include unexpected weight loss, blood in the stool, persistent diarrhea, new symptoms after age 50, significant abdominal pain, or iron deficiency anemia. Gas alone is rarely dangerous, but these symptoms definitely warrant medical evaluation. So what's a practical action plan if you're always gassy? 1, eat more slowly. 2, reduce carbonated drinks. 3, consider a dairy avoidance trial. 4, identify trigger foods. 5, treat constipation if you have this issue. 6, discuss persistent symptoms with your doctor. Most excessive gas is caused by something you're eating or how your digestive system processes food. The good news is that once you identify the cause, symptoms often improve dramatically. If you found this video helpful, please check out this video and other videos that I've posted about GI health. Take care.